Welcome to the Surrogates Corner with James Mahan.
Greetings, everyone, and welcome to the Surrogates Corner. I'm James Mahan, the founder of the Surrogate Corner, a law firm where we focus on advocating for surrogates and donors in their journeys. Today, I am thrilled to have Dr. Aimee on the show with us to discuss the medical aspects of a surrogacy journey. Dr. Aimee is widely recognized as one of the medical leading experts in the field. She's affectionately called the Egg Whisperer, and we are thrilled to have her on the show. Dr. Aimee, thank you for joining us.
Thank you, James. It's so exciting to be here with you, and you do such amazing work. So it's just so fun to be able to talk to you today.
Well, thank you very much. I appreciate that. I kind of knew of you in this space as the Egg Whisperer before. I actually even had clients who were going to you or some of my surrogates and donors who were there. So it's always fun to have you on the show. You've been doing this a very long time. You're incredible at it. I would love to kind of get a chance to sort of look behind the curtain and figure out what kind of goes on at the medical stages currently on the surrogacy side of things. What are some of the criteria you're looking for? A lot of my surrogates are nervous about the screening process. What should they kind of have in their record or not have in the record? Can you talk us through kind of like the current general ASRM guidelines and then also what you're specifically looking for in screening processes?
Absolutely. I'll start off with what I'm looking for. It's no drama. Very simply put, I want a surrogate who's emotionally healthy, physically healthy, has low stress in her life. ASRM sets very thorough guidelines for surrogates to keep them safe and the pregnancy safe. And basically, we're looking for women who've had a healthy pregnancy and delivered a healthy baby without complications between the ages of 21 and 42. And we do medical exams to evaluate the uterus. And there's also psychological evaluations as well that go into it. And every clinic has a different checklist and a different set of requirements and guidelines that may be different than the ASRM guidelines. But for the most part, the goal of these guidelines is to keep the surrogate safe and the pregnancy safe.
Okay. So what I have generally seen on my end for the surrogates who either are going to do the screening after we've done the contract or have done the screening and are kind of waiting on the completion of that is that usually the agency does a good job of kind of, checking the boxes of the big ASRM kind of criterion. There's a lot of different back and forth about what clinic or what physician has specific or very unique criterion they like to see. Do you normally see surrogates either get disqualified or kind of, I don't want to say rejected, but, not pass on at things in the record stage, or is it usually done at the physical evaluation stage or both? Or what are you kind of seeing in your practice?
Yeah, so my process may be a little bit different than a lot of patients who are going through surrogacy at their own clinics. And my process involves reviewing all medical records for the surrogate and actually talking to the surrogate and going through her medical records and making sure we haven't missed anything. Because agencies, they do their best, but they're not healthcare providers. They're not trained in reviewing medical records. And there might be something just like a couple words that might be in a record, and they don't realize that that's actually a more serious issue. So I do a thorough evaluation of the medical records first, and then I speak with the surrogate. And then if there's anything that I'm missing, I review that so that we don't go through some of the pitfalls that a lot of people go through where they've signed up with an agency, they paid the agency, and now they've presented the surrogate to the clinic, and the clinic says, well, she doesn't pass muster because of this, that, and the other that was in the medical record. So I like to engage with the surrogate first, and then once the medical records are cleared by me and I've reviewed everything and make sure I haven't missed anything, then we'll, more formally engage with the agency. So that sometimes is a little bit done backwards. And I think that's where people get upset and, their time is wasted. So if there's one thing that patients can do is, have your clinic review the records before you even pay an agency anything so that you're not tied up financially with an agency with a surrogate that will be disqualified. So most of the time, like 9 out of 10 times, patients will pass medical screening with me because I've already done a thorough review of their medical records.
Okay. And so that probably is different than some other ones who kind of like they do the matching and then the surrogate, goes and meets the clinic for the first time. And that's where, like you mentioned, I've seen that where it falls apart in the middle of medical screening. And then people are very, they've got emotionally invested in it. And now we're back to square one, trying to find a new surrogate. So that's great to know that with your process, we're looking to hopefully get all that stuff figured out before we get to contract phase. So we're not having that kind of wind up with a disappointing outcome, like in the middle of that, if we can control that.
Yeah. And, intended parents, they've been through a lot. And by the time they get to an agency, they're very emotional. And some might describe that as somewhat desperate as well. So agencies are very good at onboarding people and then making them feel even more desperate by saying things like, you're going to go on a wait list. There's so many intended parents out there. And that's something that, I have a real problem with, because that's just not true right now. Right now, I think I would estimate there are probably 10 surrogates for every intended parent out there right now with what we're seeing in the current environment. And intended parents should not feel desperate to find a match right away and pay an agency for, imagine you hire a babysitter. You don't pay an agency up front for a babysitter that doesn't exist. You want to interview the babysitter first and make sure that she's really qualified before you pay anyone anything for that service. And so things are being done a little bit backwards, I think, because patients are very desperate and, they create these emotional bonds with agencies that do a great job onboarding them, but then they're left with nothing when they match with a surrogate that gets disqualified very early on in the process once they hit the clinic.
So for you, Dr. Aimee, do you normally see with the agencies that you work with that they send the surrogate candidates to you first and kind of do that before they even get into the matching phase? Or is that sort of how you predominantly work with those agencies that you have relationships with?
Yeah, there are probably at least 15 agencies that they actually think that what I do is very efficient. It doesn't waste their time because they know, unlike other clinics, when I receive records, I'm reviewing them within days. I'm onboarding the surrogate for a screening call within a week. And then I will schedule their medical clearance appointment very quickly, unlike other clinics where it takes months to even review medical records, another 6 months to even get medical screening done. So agencies they're very, the agencies that I work with, they actually send me profiles because they know my families are awesome. They're the best patients in the whole world. They're ready. They have high quality embryos because of course I made them. Just kidding. And so they know that the surrogates will be happy. They're going to get matched a lot faster. So, one of my many sayings is my patients don't do waiting lists. We just don't, especially when it comes to surrogacy. So my process is more efficient. And the agencies, if a patient is introducing me to an agency that maybe they've been talking to and it's not one that I've worked with before, I just present how I do things. And it might be a little uncomfortable for them because they've never worked with a doctor that's as obsessed with what she does as I am. And once they see that I'm actually not scary and, I'm friendly and I really want to just move things along quickly, they realize that this is actually a really nice way of doing things.
Yeah. No, I mean, that's incredible. I mean, not only are you incredibly good at what you do, but you do it in a way that's actually better for everybody, even if it's not the system that most people, at least that I've seen from my perspective, are running it that way. So that's incredible to know. If we have surrogates who get past the screening, they're ready to go, they've made it to the point where we're now talking about scheduling transfers, doing transfers. Can you walk me through some of the current thoughts from your perspective on single embryo transfers versus double embryo transfers? What that means for maybe a surrogate on the likelihood or probability of getting a twin pregnancy? Because that's come up a lot recently in some of my contracts, and I would love to get your take on it.
Yes. So the only time I will recommend a double embryo transfer is if I have very poor quality embryos. Sometimes people come to me and they've had quite a journey. They have very few embryos left because unfortunately they realized after they've transferred all their high quality embryos that surrogacy was, and is the best option for them. And so when I'm working with embryos that are lower quality, then I will discuss a double embryo transfer. But what I actually do is try to convince everyone against a double embryo transfer.
Okay.
It is safer. It's actually more cost effective to have two surrogates transferring one embryo at a time than having one surrogate transfer twins, have major medical complications, have a NICU stay, have children that potentially have special needs because of the complications of prematurity. And I outline all of this. So I discourage patients from a double embryo transfer, especially with high quality embryos. And I get it. Surrogates want to be matched and they want to say things sometimes that will get themselves matched. And they say things like, yes, I would like I would be so happy to carry twins for you. But I tell them really like, you're okay being on bed rest, being away from your family. There is an increased risk of maternal mortality with twin pregnancies. And I spell that out very clearly. And then they hear this and they're like, oh no, I'm good. I'm good with one.
Yeah.
So I've never had a hard time with that conversation. And when I have that conversation, everyone agrees with me that one at a time is best.
And then, Dr. Aimee, if there is, let's say that the parents are either hoping for twins or are looking to transfer two embryos, what does that mean for the surrogate in terms of the likelihood of getting a twin pregnancy? Because I've always heard that a single embryo transfer splitting is very rare, but a double embryo transfer, at least with high quality embryos, puts you at a pretty good chance of a twin pregnancy. Is that what you're seeing also?
Absolutely. So, if you're transferring two high quality embryos, you're asking for twins.
Okay.
So it's highly likely, more than 50% chance that you will have a twin pregnancy. I mean, that doesn't always happen. I mean, sometimes you don't get a pregnancy at all, or you have a singleton. But if you're transferring to, the surrogate should realize that there's a high likelihood that she's transferring to. And I think surrogates need to be more informed about the quality of the embryos that the intended parents have, whether they're genetically tested, if they're day 5, day 6, or day 7. The time to ask that question isn't the day of the transfer. So I recently had an experience with a surrogate that I was screening, that she had no idea that when she signed up to be a surrogate with a previous family, that their embryos were extremely poor quality. She had no idea. And that made her go through 2 transfers that were not successful. And then for surrogates, that's kind of like a mark on their record, because now she has to say, I've had 2 failed transfers. No one wants to have that F word in their on their surrogate resume. So it just makes it harder for them to rematch, and they have to explain and all that kind of stuff. But most surrogates, I think, are, because of Facebook groups that they're in and talking to other surrogates, they're getting smarter and wiser about what to look for when they're matching with intended parents.
And then, Dr. Aimee, is that something in terms of the embryo quality or the probability of success from a transfer? Is that something that the doctors should be going over with the surrogates or not? Because I do get that a lot, for especially my surrogates are like, I got pregnant super easy with my own kids, and then they have a match, they have a failed transfer, they're coming back with somebody else. But you're right, they kind of have that stigma of like, it didn't work the first time for her. And I always tell them, like, if you've gotten this far and you've been cleared, the chances are it's not a you problem. It's more likely an embryo quality problem or something else that's going on. But do they ever get that information? Or I mean, I know it's something that you kind of are sure to do for your clients, but do you think that's happening across the board, or is that something that maybe is just not occurring as often as it should be?
I think really good agencies, and most agencies are, and they're good, and they're just getting better, I think. And I feel like a lot of agencies gather that information about the intended parents when they onboard them as clients. And so they should be presenting it to the surrogates. And I think surrogates are asking those questions. But if you're a surrogate out there listening to this and you haven't asked the question, how many embryos does the family have? Because that's really important when it comes to contracting. Because if you're agreeing to 3 transfers, they only have 1 embryo. That means that if the first embryo transfer doesn't work, now you've done all this work and there's no work for you if you really want to get pregnant and be a surrogate, and you have to wait for them to create more embryos, and you should know that up front. So I think surrogates should ask for it. I do think that agencies do a good job gathering that information and educating the surrogate, but not all surrogates get that education.
Okay. And if everything goes well, we have a great surrogate. She's been screened and cleared by you. You've got, awesome IPs with, high quality embryos. What kind of numbers are we seeing these days in terms of successful transfers? I know that it's kind of a doctor, trophy thing, is like what their numbers are, but I'm just generally speaking, like, is it something that we're usually seeing this working for most people, or are we still having a lot of issues with miscarriages or unsuccessful transfers, even when it appears on paper like everything should go well?
Yeah, I mean, I think having the right set of expectations going in is really important. And if you go in saying this is going to work the first time, that's really hard if it doesn't happen for you. But you should still be hopeful and positive that there's a really good chance that it will. I don't want to like overestimate things, but I would say over 50% of first transfers to a surrogate will work if you're using high quality genetically screened embryos that have passed testing.
That's great. Because that's the other question I often get is like, well, what happens? And especially if there's, only a few embryos left, like you mentioned, and if they've tried transferring their better or quote unquote better ones to maybe the intended mother at the time to try to carry, and now we're at the surrogacy stage, I often tell them like, you may not, you might be getting what's left of like the initial pool of embryos. So these things are not necessarily your fault, because usually they come back to me for their second contract. They're like, I'm just so bummed it didn't happen. And, I always don't want to play doctor and kind of take on that, but it's great to know that's kind of what you're seeing in terms of likelihoods and probabilities of successful transfers.
Right.
Dr. Aimee, in terms of the industry as a whole, from where you sit in your office and from the agencies you work with, I would love to kind of just get your take and a rip from you on where you think surrogacy and the industry is doing well, maybe where it's doing poorly, and if you have any thoughts on what can be done to either make this process better for everyone, more affordable for everyone, I would love to hear them, because I know you have a unique perspective with all the stuff that you do on social media and your interactions with agencies and parents and surrogates. I would just love to get your take and insight on that perspective from yours.
I mean, I think what we're doing really well is we're talking about surrogacy more and more. There's less shame involved. And the way I frame it for my patients, so they can get to the point where they're comfortable with surrogacy, is I say, look, not everyone is born with a uterus that can carry a pregnancy. There's no shame in that. So I think we're doing well in terms of awareness, and doctors are talking to their patients earlier on about surrogacy. So the experience of transferring all your highest quality embryos before you get to surrogacy, that's happening less and less. It's still happening, but it's happening less and less. On the other side, what we could do better is educating women, especially the women over the age of 40, about how surrogacy could be a better option for them, especially women who've, let's say, gone through 6, 7 IVF cycles and have only one embryo. If you think about a woman who's gone through that journey and she only has one embryo, I think it's unfair not to bring up surrogacy to her, because there's a reason why she had to go through IVF. She's never been pregnant before. And if she has only one embryo, it might be that a surrogate could give her a better shot at having a healthy baby versus her own uterus. So I think we could do better talking about surrogacy to patients up front without them having to go through many failures before they get to the point where they choose a surrogate. As an industry, I think that we're doing really poorly in terms of preparing intended parents and surrogates for the emotional journey still. So if I were to do something and make it a requirement, I would require joint psych education appointments between the surrogate and the intended parent, and make sure that that same psychologist is facilitating meetings throughout the journey. When a journey goes well, it's like, you don't need a psychologist.
Right.
But, 10% of pregnancies will end in a biochemical. Even with genetically screened embryos past 10 weeks of pregnancy, there's still a 1% chance that you can have a fetal demise. What happens emotionally is surrogates can blame themselves. Intended parents could somehow blame the surrogate. There's this lack of communication, and now you're supposed to rebuild the relationship and try again. I think that doing better in terms of supporting surrogates and intended parents with their mental health needs throughout their journey would be helpful. The cost of surrogacy is higher than ever. There's a lot of things that kill me inside. One of them is how agencies charge a fee that's actually more than what the surrogates make. Like, how does that make sense? An agency is going to collect over $60,000, but their surrogate's going to make $45,000 or $50,000. And while the agency work is really important, but they're not putting their own health at risk for someone else. They're not taking shots for sometimes up to 12 weeks. They're not getting probed and having procedures done and having to go through childbirth. And so I think that as there are more and more families that need surrogates, there are really cool programs like Nodal that Dr. Levine has started. I think his program's great because it helps with the cost. But what's happening is, because of the rising costs, people are now trying to find surrogates through Facebook groups. And there are lots of things that can go wrong with that approach. While it can sometimes be great, but there are lots of horror stories around doing that as well. So I'm hopeful with, different ways of not necessarily cutting out the agency, but being more creative around how the agency works that can drive down costs for families.
Yeah, from my perspective, I don't usually see what the agencies are charging because I don't really work with intended parents very often. But even just on like the surrogacy comp and the competitive nature of marketing and going after potential surrogates, I've seen a much bigger increase in independent journeys that are trying to go outside of an agency to save agency fees or to find a surrogate who's not necessarily part of the $70,000 to $100,000 club of what they're asking for. So and I know that from my limited perspective on the legal side, like our legal fees haven't really changed that much over a decade. I mean, they may be, a couple $1,000s potentially on either side. And I don't think the medical fees have necessarily gone up exponentially the way that it seems like the costs have. So that's, like I said, I do think those other programs that are coming up and looking at how agencies are structured, how they do their payments, or how they, retain and earn their agency fees is something that's kind of being talked about. But I know that's one of the big issues that I do see, even though I'm not dealing with parents very often, is that it's just such an expensive endeavor these days that, trying to find ways to shave at the corners as much as we can is something that people are always looking for.
Right.
Dr. Aimee, thank you so much for your time, for your insight, for all the things you bring to this industry and to the community, and just for being an amazing physician at what you do. Everyone, thank you for tuning in. I hope you enjoyed the show. We've got Dr. Aimee coming back on for part 2 to talk about egg donation journeys. So please tune in, share this with anybody you know that's thinking about starting a surrogacy journey, and always come back next time. Thanks a lot.
Thanks for watching. Be sure to hit that like and subscribe button and leave us a review in the comments.